Are you vaccinated? No? What's the holdup? Before we get to those who are still hesitant to get the vaccine, those who want to be vaccinated, we have some good news for you. There's a massive nationwide vaccination drive targeted at adults before the end of the year. And for those in the nation's capital, the target is 1.5 million people in 50 days. You'll see more of this in our FCT Focus. Our guest on the program is the National Incident Manager of the Presidential Steering Committee on COVID-19. And we're talking about deadlines for civil servants to get vaccinated and what to do about you who are hesitant to get the COVID-19 vaccine. And as we do every week, we present our Abuja wrap. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I'm Kayla Megwa. Let's kick off with a roundup of major stories that made headlines within the week.
President Muhammadu Buhari is tasking African leaders to support First Ladies on the continent to advance peaceful coexistence. The president made the statement when he declared open the 9th General Assembly of the African First Ladies Peace Mission in the State House.
The importance of this assembly lies in the fact that peace has become an elusive subject that affects development in many regions of Africa. I would like to reiterate the commitment of our government to the resolutions of this assembly, and I invite other African leaders to do the same.
The president has approved February 2022 for the conduct of the National Convention of the All Progressives Congress. Chairman of the Progressives Governors Forum, Governor Atiku Bagudu of Kebbi State, made the announcement after a meeting with the president. The meeting was also attended by the chairman of the APC National Caretaker Committee, Governor Mai Malabuni of Yobe State, as well as Governor Abubakar Badaru of Jigawa State.
The Progressive Governors Forum discussed the issue of National Convention of the party, and they mandated us to come and discuss with the president as party leader to give the inputs of the governors so that the party and the president will consider in agreeing a date for the National Convention. Part of the input we got was that we still have 4 states which are in the process of completing their congresses. Anambra, understandably because of election, Zamfara, and 2 others that because of logistic challenges are yet to complete. The governors, based on all that, made an input that we think the party and the president might graciously consider February, and president is favorably disposed, and I'm sure the party, because the party, the chair of the caretaker committee was part of the delegation, he heard that, and I'm sure they will conclude between him and the president. But we have made the input of the governors known.
President of the Senate, Ahmed Lawan, has called on aggrieved governors in the party to engage with the National Assembly over the direct primary provision in the Electoral Act Amendment Bill. He made this known after a meeting with the president in the State House. The president also met with the new chief executive officers of the Nigerian Midstream and Downstream Petroleum Regulatory Authority and Nigerian Upstream Petroleum Regulatory Commission. The new agencies were created from the passage of the Petroleum Industry Act. They were led by the Minister of State for Petroleum, who told State House correspondents that the government is working towards addressing the hike in the price of cooking gas.
When we see gas prices going up, gas prices are not also determined in Nigeria. Just like you, we are also checking what the price of gas is in the international market. But of course, there are some elements of the pricing that we can think out, and I can assure you that we are doing everything to ensure that those elements of the pricing are adjusted. Mr. President also is very concerned. He's aware that the price of gas is high in the market, and we are doing everything to see how we can bring down the price of gas, especially as we approach the Yuletide.
The president presided over the National Security Council meeting. Before the commencement of the meeting, President Buhari decorated his aide-de-camp, Lieutenant Colonel Yusuf Mukhtar Dudu, with his new rank of Colonel. At the end of the meeting, the Minister of Interior said government is doing its best to tackle the insecurity in the country. The president bade farewell to the outgoing Indian High Commissioner to Nigeria, Mr. Abe Tako, and the outgoing Italian ambassador to Nigeria, Dr. Stefano Ponticelli. The ceremony was witnessed by the Minister of Foreign Affairs, Mr. Jeffrey Onyama, and Chief of Staff to the President, Professor Ibrahim Gambari. Meanwhile, the Vice President, Professor Yemi Osinbajo, bade farewell to the outgoing United Nations Resident Coordinator in Nigeria, Mr. Edward Kalun. During the farewell courtesy call, Professor Osinbajo said engaging with the people and their needs remain the major concern of the government. Professor Osinbajo also bade farewell to the outgoing Executive Director of the Nigerian Export Promotion Council, Mr. Segun Awolowo. He says Nigeria is on the right path to economic diversification, with a focus on non-oil exports and a zero-oil plan actively promoted by the NEPC. Professor Osinbajo met with the University of Lagos Alumni Association, led by its national president, Dr. John Momo. In a statement released by the Vice President's media aide after the closed-door meeting, Professor Osinbajo made a case for increased research in the country. The Federal Executive Council has finally approved the business case outline for Nigeria Air, which kicks off by April 2022. Minister of Aviation, Senator Hadi Sirika, made the announcement after this week's council meeting. Meanwhile, the federal government has announced that the 5,000 Naira Fuel Subsidy Relief Fund to be paid to the most vulnerable will be transferred digitally for a period of 6 months. The Central Bank Monetary Committee has decided to leave all key policy parameters constant at 11.5%, in line with expectations. The CBN Governor, Mr. Godwin Emefiele, disclosed this while reading out the committee's communique.
Welcome back. Let's talk about vaccination in the nation's capital. The target is 1.5 million people to be vaccinated in 50 days. A paltry 132,000 FCT residents had taken at least a first jab by July of this year. Hopefully, they should all be vaccinated by now, but this vaccination started in March this year. The FCT is home to an estimated 3.5 million people, according to the National Population Commission. How will the FCT administration get 1.5 million people vaccinated in the next 50 days? How do we avoid wasting these vaccines that cost so much to make, transport, and preserve? Well, they say it is best to start the drive first. And that's exactly what the FCT administration is doing. Please watch this.
The drums are rolled out as the Federal Capital Territory Administration begins effort to ramp up COVID-19 vaccination among residents. But it's not a time to celebrate for the administration, as Nigeria is yet to make any significant achievement in the COVID-19 vaccination exercise. According to the National Primary Healthcare Development Agency, only 3.4 million Nigerians are fully vaccinated. That's about 1.7% of the nation's population, while over 6 million persons have taken single doses of the vaccine. The administration is hoping to vaccinate 1.5 million residents over the next 50 days.
Our flagging of the COVID-19 mass vaccination campaign in the Federal Capital Territory. As you are aware, COVID-19 is a virus disease caused by an emerging coronavirus strain. The disease continues to spread worldwide at an alarming rate, and the signs are that the impending winter season is likely to witness another wave of infection. This demands decisive and stringent actions to curb the scourge. In this wise, vaccination with safe and effective COVID-19 vaccine is a critical part of the FCT strategy to control the pandemic. The objectives of implementing the COVID-19 vaccination in the Federal Capital Territory includes the reduction of pressure on the healthcare system, reduction of overall COVID-19 severity and mortality rate, the opening of the society, and COVID-19 elimination in total. During this first phase of the COVID-19 vaccination, The Federal Capital Territory Administration achieved over 100% coverage. As we adopt the skills strategy for deployment in the third phase of the COVID-19 vaccination rollout activity, bearing in mind the target of the additional 1.5 million residents in the next 50 days, there is the need for the collective responsibility of all eligible FCT residents, including persons of 18 years and above who have not been vaccinated, to present themselves for vaccination as soon as possible. Within the period of the vaccination exercise, this is in addition to the strict adhering to the COVID-19 non-pharmaceutical preventive measures and protocols.
I can assure that the mass vaccinations implementation strategy scales will be enhanced efficiently in the FCT using context-specific and evidence-based innovations, which is our culture in the FCT Health and Human Service Secretariat. All of us have one responsibility to educate others on the safety, effectiveness, and efficiency of the COVID-19 vaccines, as this helps to build trust in the decision to be vaccinated. This one-on-one vaccine education and other efforts of the FCTA are needed to achieve the target of protecting additional 1.5 million residents of FCT against the COVID-19 over the next 50 days.
The FCT commenced the first phase of vaccination on March 18, 2021, about 2 weeks after the federal government began the exercise. Since then, the exercise has not yielded much result. The idea of mass vaccination is to secure the buy-in of various groups in the society.
It is always movement of people coming in and going out of the FCT on the daily basis. Therefore, I want to appeal to the two ministers to look inward and take measures, ensuring that all persons are properly investigated. Furthermore, I would like to appeal that this campaign against COVID-19 should be extended to the 6 area council. May I call on the residents of the Federal Capital Territory, Abuja, to use this opportunity to ensure that they are vaccinated.
According to the Nigeria Center for Disease Control, the FCT has recorded 23,477 cases of COVID-19 as of Thursday, November 25, 2021. 23,095 of the cases have been discharged, while 158 are still on admission and 224 deaths have been recorded. The FCT administration insists that residents must still adhere to the COVID-19 protocols.
Health experts have made us to understand that the causative agent of COVID-19 could be prevented from having access to the body by observation of non-pharmaceutical protocols, including hand and respiratory hygiene with physical distancing. In addition, vaccination with safe and effective COVID-19 vaccines will moderate the disease should the first barrier be broken. Therefore, when non-pharmaceutical preventive measures are observed with a fully vaccination status, the COVID-19 germ has no opportunity to cause affliction. Hence the importance of today's exercise.
The administration is assuring residents that more is being done to address the challenge of boosting routine immunization, disease surveillance, outbreak preparedness and response services, as well as strengthening the primary health care scheme implementation in the FCT.
My guest on the program is Dr. Mukhtar Mohammed, the National Incident Manager of the Presidential Steering Committee on COVID-19. Civil servants have till the 1st of December to get vaccinated, and he tells us why. Only 3.4 million Nigerians have been fully vaccinated out of our over 200 million people. And he tells us why. According to him, the 40% target for vaccination cannot be met if we continue at this pace, but some sort of work must begin. Please watch this. Dr. Mukhtar, welcome to Dateline Abuja.
Yeah, good day, Kayla. It's really a pleasure to be here.
Let's talk a bit about this mass vaccination exercise. What's the plan to get at least half of the country vaccinated? Let's just walk us through how this is supposed to work.
So the federal government, through the Federal Ministry of Health, has developed an elaborate plan to ensure that there is vaccine availability in almost every part of the country. All the states have been supplied with vaccines. Government facilities have been supplied with vaccines. Another plan is to engage the private sector because we know that 60% of healthcare is obtained from the private healthcare in this country. So to engage the private sector as well. In addition to this, we are looking at new innovations, including vaccines in public places where they will also be made available. We are starting with the FCTA now. And some other states have also commenced. The whole idea is to ensure that there is access to vaccination, to make sure that when a Nigerian is looking for vaccine to be vaccinated, he readily finds it available, not far from where he stays. So that is the plan. It is an evolving plan. If you recall earlier on in the vaccination program, what we had, it was a tiered approach. We wanted to start with people who were between certain ages. We wanted to start with people who had comorbidities, people who were vulnerable. But now we are taking on all adults. All adults should have access to this vaccine. And it's something that we need to do within the shortest possible time.
So no children for now?
No children for now. Our priority is to get the adults.
So we're talking about 18 and above?
Absolutely, yes.
And that's the plan for the end of the year. You mentioned the private sector. And just to bring up something I noticed, even when it comes to testing for COVID, you know, private facilities charge you, you know, before you get your results. And there are variations of times when you can get your results, 24 hours, 48 hours a week. But, you know, we always say, oh, you can go get tested, go get vaccinated, it's free. Just to explain to people why there's this disparity between, you know, receiving a COVID vaccine in a public health institution and getting it from the private. Why is there a cost implication in many private hospitals?
So for vaccinations, all the vaccines are free. We procured, the government, or we got donations of these vaccines, and we make it available up to the facility where it is delivered for free. Handling the vaccine requires a lot of resources. There is logistics of moving the vaccine from one point to another. There is logistics of maintaining the cold storage. The vaccines have to be kept under certain minimum temperatures for some time. There is also the cost of personnel that you have to use to either move these vaccines or to administer these vaccines. There is cost for data entry. You have to use the software. You have to have a computer system or tablet or telephone or whatever is available to enter the data. There is the human resource cost that you also pay for individuals that do this. So apart from delivering the vaccine to the last point, there are also additional resources. Government is taking care of all these additional resources, which cost as much as the vaccine itself. In government public health facilities. Government has made provision for the transport, for the storage, and for the payment of personnel that are involved. Now, when you bring in private sector, it is slightly different because the private sector now have to employ people who will do this job specifically. So there is a cost to that. They have to get computers.
A little bit more to keep it cold.
Exactly, and then even the cost of storage and others. So what we've done is to work with the private sector to just look at the minimal marginal cost that they can charge for these services. However, the vaccine is delivered to them free. This is understandable because in all private, even in government, it's not that there is no cost. There is cost, but it's being paid for by government.
I hear that we have about 12 million vaccines in the country right now. We'll get to the target vaccination population for December shortly, and then the fact that civil servants have a deadline, to get themselves vaccinated. But look, just walk us through how many vaccines we've gotten in the country since March.
Absolutely. I know we got quite a number of vaccines. You remember we started with the AstraZeneca. We got about 4 million doses. We got Moderna, which came. We got donations of additional Oxford AstraZeneca, from other countries. We got also Johnson & Johnson, which was procured by government through the AVAT facility. So right now we are coming to a period where we now won't say that we have shortages of vaccines in the country. At least every state has enough vaccines for now, and there are a lot of vaccines also that are available that can be distributed to boost the vaccines in the state. You are right, the total vaccines that are available in the country now is said to be about 12 million doses of the combined Oxford AstraZeneca and the Moderna vaccines that are available. But what we also know is that the Federal Ministry of Health has secured vaccines that are coming into the country. We do not want to bring vaccines when there is no need for them. For example, you don't want to oversaturate the country with vaccines, and then we'll end up with vaccines expiring in our hands.
Because people don't realize that vaccines actually go bad.
Yes, so we are very careful in terms of the management of the vaccines that come into the country.
So let's go to the vaccination population, because that's where we are right now. When this exercise started, 40% of the population was targeted, but just about 3.4 million Nigerians have been fully vaccinated. How are you going to ramp up this number so you can meet the target that you have for the end of the year?
It's absolutely very challenging. I'll tell you the truth. At the rate we are going, we know that we will not be able to meet this target. And that is why concerted efforts are being put by the federal government and also the states. These vaccines are administered.
We will not be able to meet this target?
We will not be able to meet 40%. No, we won't. We won't. Our target of even providing 40 million Nigerians with the vaccine by January next year, it's really a long term. It's a long haul.
What's the challenge? Why can't we meet it?
So there are several factors.
Is it vaccine hesitancy?
Absolutely. Absolutely. That is the topmost issue. Initially, we said there were no vaccines in the country. Now the vaccines are available.
Now the people don't want to come out for them.
And people are not coming out to do it.
Is the Nigerian government, in your view, doing what they can to ensure that people feel safe about taking these vaccines?
So I'll really shift a little from that, because it's not entirely, you cannot put that squarely on government alone. It is a responsibility of everybody. If you know you have members in your family, how many members of your family have gotten vaccinated? If you are convinced you have taken your own vaccination, then you need to pursue others, to persuade them to also take vaccination. It's individual, it's family, it's community. You need to work with your neighbors. Make sure that your neighbors also get... some of the people actually don't have the right information. They don't have the education. They have not been sensitized enough. And you cannot wait and say government has to come to your neighborhood and provide that level of sensitization, that level of education.
Well, Dr. Mukhtar, this is where we have to end the interview today, I'm afraid. But thank you very much for being with us on Dateline Abuja. And good luck with the work that you do.
Thank you, Kela. It's always my pleasure to be on your program.
Thanks to Dr. Mukhtar for talking with us. The distrust in government is so strong, and this is the evidence. The vaccine is free. The president and the vice president took the vaccine on television. Jingles in several languages. 3.5 million people out of 200 million? As we speak, a new COVID variant has been discovered in South Africa, and researchers are grappling with understanding it and if it is resistant to all the vaccines we've been taking. Talk more of how it will impact unvaccinated people. Why do we need more Nigerians vaccinated? It is to create herd immunity. Let me explain. Immunity can be achieved in one of two ways: prior infection or vaccination. In many cases, relying on prior infection is unrealistic. Vaccines are more reliable, and we see this in illnesses like polio and chickenpox. Widespread vaccination makes large sections of the population immune to a given disease, dramatically reducing the potential to transmit it to other people, and ultimately preventing an outbreak from happening. So as with adhering to COVID-19 protocols, when you get vaccinated, you aren't just protecting yourself, you're protecting others as well. Empathy. That's our show this week. Please let us know the happenings in your neighborhood using the social media handles showing right now on your screen. Thank you so much for watching. I'm Kayla Magwa. See you next time.